Good morning, everyone, and thank you for joining us. I'd request us just to wait a few more minutes just to allow a few more participants to join us, and we're going to begin.
Food security is said to exist when all people have both economic and physical access to safe, sufficient, and nutritious food that will help meet their dietary needs and preferences for an active life. To attain this, it is therefore important to understand the four key facets of food security, which include food availability, access, use, and food stability. Get to learn this and more in our certificate program at Humanitarian Global. Among the topics that will be covered include Introduction to Food Security and Nutrition. This module will familiarize you with food security and nutrition, nutrition problems, vulnerable groups, and causes of malnutrition in emergencies. Secondly, Nutrition Assessment. In this module, you will learn about nutrition assessment, community nutrition assessment, food security assessment, and community mobilization in emergencies. Thirdly, Food aid and livelihood support. Get to understand about livelihood support in emergencies, nutrition information systems in emergencies, food aid, humanitarian assistance and standards. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.
Thank you for being patient with us, and you'll see in 3 minutes we can start at 5 past. Good morning, everyone, and thank you for joining us this morning. My name is Eric, and I'm part of the Humanitarian Global team. I work as the academic coordinator, and I want to thank each and every one of you for joining us today for this session. And with me, I have a key presenter for the day, Irene Marigi. Irene, are you there with us?
Good morning. I hope you can hear me clearly.
Yes, I can hear you clearly, and good morning. And also thank you for joining us. And just before we begin, I just want to share a few things. Kindly let us refrain from sharing our emails on the platform. When you registered, we got those details, so we have them with us. So kindly do not share your personal details, your email and your phone number on the chat section. And also we have the Q&A session where you can post your questions. And the questions may concern either Humanitarian Global as a whole or just questions for our presenter today. And with that, I like us to begin. So Irene, you may take us off.
Okay, thank you for the introduction, Eric. Good morning, everyone. My name is Irene Maregi. I am a facilitator at Humanitarian Global, and my area of specialization is food security, nutrition, and maternal and infant child health. So today we are covering a topic under the food security docket, but it is relevant for all people in the humanitarian industry because it is about community mobilization. So when we talk about community mobilization, you understand that it is important because we work with communities as humanitarians. So when we are implementing a project, we do not just do it by ourselves or just with the government, but it is important to also involve the community. So today we are going to look at what community mobilization is, why it is important, especially when we're implementing food security programs, and how we can ensure that we involve the community from the beginning to the end. So our agenda today is, as I said, look at what community mobilization is, look at the various steps you can follow. They are very easy steps that you can follow to ensure that you mobilize the community. Then we'll identify key community representatives and their different roles. And then finally, we will look at the importance of community participation from planning to implementation of food security programs. And then finally, we will have an open floor where you will be able to ask all your questions and give your feedback. So let's get right into it. So community mobilization is used to cover a range of activities that, in this case, health nutrition program implementers, that is nutritionists, managers, and health workers, build a relationship with the community and foster foster people in the community to use the nutrition program. It also helps health workers better understand the affected communities they're working in, which is essential to the success of management of malnutrition. So when we look at food security and the projects that food security addresses most of the time, they address challenges in terms of people getting the food, that is food insecurity in itself, and also the outcomes of this food insecurity. So there are a lot of programs going on that are aimed at improving the nutrition status of the community, or even preventing or treating malnutrition. So when we talk about community mobilization, it's all the activities you can think of that will help you as an implementer of a program build a relationship with this community, a good relationship, so that the people can accept your program and can be able to benefit from it by using the program. Also, community mobilization will help you, because most of the time you find that when we are implementing food security or nutrition programs, we might find ourselves working in communities that we are not really familiar with. You might end up working in a community as coming from the outside in. So it will also help you understand this community, understand how this society works, because also at the end of the day, we have to come up with solutions that are acceptable to these people, and also help them understand why it is necessary that we are carrying out these programs. So it's two-way. It will help the community in terms of getting the help and understanding why they need it. It will also help you as the humanitarian understand this community and know how you can help them better. So there are different goals of community mobilization. So one is to provide a link for the community and the existing health facilities. So when we're implementing food security or nutrition programs or humanitarian programs, even in general, we make use of the existing infrastructure. So you may find that you need to make use of the existing health facility or the existing healthcare system. And you can become sort of a bridge where you link the community to services that are being provided by the health facilities. You also use community mobilization to create awareness on the treatment of malnutrition, also on existing cases of malnutrition, because in some communities, they do not understand how malnutrition comes about or what causes it. So just to create awareness on the occurrence, on the management, on the prevention even, and the treatment of malnutrition. To provide early detection for and treatment of malnourished individuals. So when you are involved in the community, or the community gets involved in your project, they will help you detect these cases of malnourished individuals or food insecure individuals early on, so that you can help them when you still can turn around the situation before it gets so bad. And then you also promote community participation. So when the community participates in a project, then they feel a sense of ownership that will even improve your sustainability. So there are different steps in community mobilization that we talked about. And so we do not just get into a community, identify a problem, and then decide, let us involve the community. We have to be smart about it. We have to plan for it, and we have to have a plan of action. So there are 2 phases and 5 steps. So the first phase is the planning phase. Now, this involves the assessment of community capacity to determine gaps and levels of participation. So when you want to start involving the community, you have to assess their capacity and determine at what levels can they come in and participate, and which gaps exist between the community and our project. So you have to carry out a very good assessment, which will guide you on how you're going to involve them. And then we have the implementation phase, which is the actual community participation. The implementation of the nutrition and care program and sensitizing community members on the importance of nutrition. So when you're implementing, for example, a nutrition program or a food security program that is dealing with food insecurity and malnutrition, you have to have a plan on how you're going to sensitize the community members, because first of all, if they do not understand what it is you're doing, then they are less likely to participate. So you have to educate them, you have to sensitize them, you have to help them understand what your program is about. They have to come to a place where they understand what the project is about, and also they can be able to see how they are going to benefit. Because if they do not see any benefits to them, then they are less likely to participate, and you may find that your project is really not sustainable. And so in a pictorial representation, there is the planning phase, which is assessing community capacity. And then the implementation phase has 4 steps, where you do community sensitization, you do case finding, and then you have follow-up, and then ongoing sensitization. So we will look at each of these steps. So the first step is assess community capacity. So to assess the community's capacity, first, identify the community representatives and community groups and organizations that will help to inform communities about nutrition and malnutrition, identify and screen malnourished individuals, conduct treatment and case follow-up. So here I'm just using an example of malnutrition in the context of food insecurity. But basically, this step starts when you identify these community representatives that we are talking about, and you identify community groups or organizations. So you find that in most communities, there is some sort of, there is a way they are organized. So you find that there are leaders and community representatives, or there is a way that they are organized. Maybe there are women groups, maybe there is a council of elders, maybe there is the local administration, the chief, the sub-chief, and all of that. And so you have to identify these representatives. You have to identify these community groups that are going to be key in helping you carry out the sensitization. So that is the first step. The second step in under assessing the community capacity is to establish the formal and informal channels of communication in the area. So under the formal channels, we have the posters, going around with a megaphone and making announcements, using the chief's baraza, or what we call the chief is when the chief gathers people for announcements. You can even use the local newspapers and the local radio channels or TV channels. All those are the formal ways of giving out your message. And then you also look at the informal channels. So the informal channels are very important because the formal channels do not reach everybody. So for example, some formal channels like the posters and the messages are limited in that they only get to people who can read and understand them, okay? And also they might not reach everybody in the community, but the informal channels are much more effective in reaching everybody. So for example, if you go to a marketplace and it's a market day, you're likely to reach a lot of people than just putting up posters all over the place and nobody knows what the poster is about. Or if you go to ceremonies like weddings and funerals, you're likely to get your message received by a lot of people. So both formal and informal channels should be established. This will help health workers share information and open up dialogue with the community members. So when you establish these channels of communication, then you open up a conversation. You introduce yourself to the community in a sense, and now this starts the ball rolling. People start the conversation and start getting curious about what it is you want to tell them, and now this becomes your first point of contact with the community. And then we move on to step 2, which is community sensitization. And this is a way to reach out to people in the community and teach what you want. In this case, causes, signs, and symptoms of malnutrition, and teach how to seek treatment opportunities. So when you're carrying out community sensitization, you need to now, after in the first instance, when you already established a point of contact, then now you come in with your message. So community sensitization is basically just teaching the people about the problem that is there and how you can help them solve this problem, or how they can identify this problem, and also how your project is going to help them solve this problem. So you, one, should plan messages that are simple and explicit in local terms. So you need to understand that you are coming in as a professional, you have a certain level of education. There are terms you use, there are words you use that might be a bit difficult for the people to understand. So you need to find the local terms, the local names, local ways of explaining things to these people that will help them understand. So even if you are the professional here and you have all the scientific names and all the lingo that you know about a certain issue, that will not help you when you're doing community sensitization. You should come down and talk to them in a language that is simple and direct, that they will understand. So you have to look for a way to make your message simple, clear, easy to understand for these people. So for example, if we're talking about a project that is solving malnutrition, you have to think about what is malnutrition, what are the signs of malnutrition, what are the available treatment services and methods used for treatment, and access points for these treatment services and those who benefit from the treatment of malnutrition. So if also you're talking about, let's say, food insecurity, you have to think about what is food insecurity? What are the signs of food insecurity? How can we solve food insecurity? If you have a challenge and there is help out there, how can these people access these channels, and how can people access this help? So always plan your message clearly. And then the second step in making community sensitization is to make a sensitization plan. So decide who to inform and how to best get the information out. So consult a few community members first to make sure the messages are culturally appropriate and inoffensive. So while working in communities, you will realize that there are ways you can package your message, or there are ways you can present your message that might come off as insulting, or might even make the people feel that you do not respect their culture, that you're questioning their values, or that you do not understand what their problem is. So it is important to have people from the community who are respected and who understand the culture of these people to go over your messages and to tell you if they are, one, culturally appropriate, and if they are going to be offensive or not. So you may find that in some, especially African cultures, you may find in some communities, there is a certain way you're not supposed to address a certain group of people. So there is a way, for example, I am a lady. There is cultural restrictions in some communities on how I can address elders, or on how I can dress even when addressing them, or even how I can address the male members of the community versus how I am allowed to address the female members of the community. So you have to take all these into consideration, because you want to help the community, so you want them to be on your side. So you have to make sure that your message is simple, is clear, is culturally appropriate, and it does not offend the people you're trying to help. And then number three, you have to sensitize the community representatives, groups, and organizations, and use pictures to strengthen the message. So once you already have a message and you have the green light. You have the go ahead that this message is appropriate. It addresses our problems in a respectful way. You're not going to offend anybody. And then now you have to find out how you're going to get this message out into the community. And that means that now the community representatives that we identified in step 1, the groups and the organizations, are the first people you're going to sensitize, or the first people you're going to tell what you're doing. So because they represent the community to a large extent, and you may find that if you leave them out at this point, they will not approve of what you're doing. And now that has an effect on the entire community, because projects have failed because the community has rejected them. It might be a good project. It is probably in the best interest of the people, but because somebody did not get involved somewhere, they do not understand what is going on, and they end up saying that we don't want you here because you did not involve us. We don't know what you're doing with our people, so pack up and leave. So it's important that these community representatives get the message as the first people in the community. You can even use pictures to teach them and help them understand, because once you get approval from these community representatives, then your work is really made easier as you go along. Now, after you sensitize these community representatives, of course, they are going to go back into the community and spread the message. So you're not just going to stop at giving the message to the representatives. After you talk to the community representatives and you agree and they get to understand what it is you're doing and approve and give you your support, then they will help you continue passing on the information. So you do not just stop sensitizing after you tell the community representatives. They are just the first people that you tell. And then after you get the approval, now you can make maximum use of your channels of communication, the informal channels and the formal channels, because they, the key leaders will have given the approval, and now the people can be educated. And then we move to step 3, which is case finding. So community health workers and community volunteers will screen and identify malnourished individuals based on anthropometric measurements and presence of nutritional edema. Screening takes 2 forms: mass screening and active case finding. Severe and moderately malnourished persons are referred to the health facility for management of malnutrition. So I am using the malnutrition issue a lot, but I hope it's helping you understand clearly what you could do in a case-by-case basis. So after you have already sensitized the community, then now you need to start finding cases for you to help in the community, or what we call targeting. So because projects have a certain target audience, so if you have a food security project and you're giving livelihood support, for example, and you're giving food for work, then you need to identify the people in the community who have food insecurity so that you can offer them this solution that you have. If you're giving vouchers for the market, for people to go to the market and get food, then you cannot give them to everybody. There is a target you have in mind. So this is what we are talking about when we say we find cases. So you can do a mass screening first and generally involve a large part of the community when you're doing the mass screening. And you can also carry out active case finding, where you want to now really narrow down your target audience and really get the people that you want to help. So that is the 3rd step. And then the 4th step is follow-up. So when you're involving the community, you do not just involve them up to the point of you have sensitized them and you've gotten your target audience and you have your cases. So now you just leave it at that and continue on with your project. When you involve the community, you have to do something we call follow-up, which is very important, because remember, your project had goals, and some of these goals means that you had targets. And I'm sure one of the main goals that a lot of projects have is to make a difference or to improve a certain situation by a set margin. So maybe you want to resolve malnutrition and reduce the cases of malnutrition maybe by 25%. So if that is your target and you've identified your cases and you've helped them, if you do not do any follow-up, then you will not know the impact that your project had. So follow-up is very important. Even after you've helped the people, you should go back and conduct follow-up. In this case, I'm talking about home visits. So if, for example, you are dealing with malnutrition and you had patients come on board, you treated them, maybe you even referred them to other projects that are doing livelihood support or are giving food aid, then after a time, then you should go back to these homes and find out, are these patients recovering? Is their medical condition better or worse? Are they responding to treatment? Are they going for follow-up visits? Do they need more help? Do they need more counseling sessions? Do they need more monitoring? So when you do follow-up, you really find out a lot. One, you find out if your interventions were successful. So if you are giving, for example, general food aid and you are giving food portions. So if you are giving food aid to our families and you go to and visit these homes for follow-up, then you will be able to see, did our food aid improve the health and the nutrition status of these people? Okay, has their living condition improved? Okay, do they have better coping mechanisms as a result of what our project did? So it will help you understand and really evaluate if your interventions were effective. Number two, it will also help you avoid a lot of what we call people who do not follow up with the program or dropouts. So you may find that if you started a project and you had maybe a target audience and you got maybe 5,000 children who are involved in your project, if you do not carry out follow-up, you may find that after a year or a few years down the line, you find that the number of patients who are still on follow-up are around 4,000, and you've lost 1,000 along the way, and you do not know if they recovered, if they finished their treatment, if they are better or if they are not. So follow-up will also help you retain people in your project or your program and avoid these dropouts, okay? And then it will also help you get feedback on these interventions. So if you do follow up and you find that this person recovered from malnutrition or this household is now food secure, then they will be able to give you feedback on why your interventions worked and why some of them may or may not have worked. So follow-up also gives you, as the project implementers, direct feedback on your activities. So home visits are also an opportunity to encourage a patient to return to treatment or provide support to caregivers to ensure recovery, and inquire on reasons where a patient has defaulted or is showing poor response. And a standard checklist is used when you're doing follow-up. So also follow-up will help you encourage the people in your program, and also will help you identify other ways you can provide support. So if you do follow up, for example, on a child who is suffering from malnutrition, and you do follow up and you realize 2 months down the line, this child is still malnourished, but you have been giving them therapeutic feeds or supplementary feeds. When you go to the house and to their home and do follow up, you may be able to identify reasons why your intervention is not working and ways in which you can support them. Maybe the reason why the supplementary food is not really helping is because the household is food insecure. So when you give this child the porridge flour to go home and use as a supplement, it's being shared among the entire family. And if you did not do any follow-up, you would not have found out that it is being shared because the other children are also hungry. And now when you do that follow-up, you will realize that there is a bigger challenge, and you might be able to help this family by linking them with other projects that carry out livelihood support. And now in that way, you're going to ensure the recovery of your patient. So follow-up is really, really important. I cannot insist enough, because a lot of projects do not do follow-up. They come in, involve the community, identify cases, carry out the interventions, and then forget about the follow-up and just come back to do the evaluation. But your follow-up will really help you when you're implementing this project. And then the step 5 is ongoing sensitization. So community sensitization is an ongoing process. Community members, by attending meetings, can regularly voice their views and suggest alternative courses for action. The community resource person and other community workers maintain regular contact with the community to identify problems and work together to provide timely solutions. So when we talk about community sensitization, it should go on, ideally, the entire course of your project. So you should keep in touch with the community and find ways in which you can get them together, in which you can get their views, in which you can get feedback, in which you also continue giving this information, because at the end of the day, after your project is done, you want to have made an impact in the community, and you want this community to gain something from your project. So you need to carry on community sensitization all through your project. And through this ongoing sensitization, you find that you will get suggestions on how to improve some of your interventions. You will get suggestions on how the community is doing, how the community is receiving the project, and any other kind of feedback that is really key in your project. So a regular means of maintaining contact with the community should be established as soon as the program is operational. So during the design stage of your project, information collected on appropriate channels, individuals, and forums in which to conduct this dialogue can be useful to the process. So when you're designing your project, make sure that you include a way of regularly maintaining contact with the community, either through community meetings or through meeting the leaders, or even just using the existing groups or organizations within the community. And so those are the 5 steps to ensuring community participation. So now we look at some of the key community representatives, and we have the administrative leaders. So because of the way our governments are organized, we have administrative leaders down to the village level. So in most instances, when you go to a community, you will find an administrative leader, whether it's a councillor who was elected, a chief who is a representative of the government, a sub-chief, and the village elders. So the administrative leaders are very important, and you should identify them and involve them also. Then you have community workers from the Ministry of Health and other government departments. So you find that some of our Ministry of Health already have community health volunteers. There are community health extension workers. There are people who help with community vaccination, agricultural extension workers. There are social workers even in hospitals. So these community workers will help you understand the community. They really are a very good source of information about what is happening in the community. They will also direct you very well on how to tailor your message to make it relevant to the people. They will tell you the easiest way to really get to your target audience or your target people that you want to involve in your project. So the community workers are very, very involved in the communities. They are a wealth of information, I tell you from experience. So they know what is happening, they know who is who, they know when is the best time for making a meeting, they know how you should talk to the elders, they know how you should talk to the women, they know a lot. And they also know all the projects that are going on in the community. Because it's also important to understand that when you have a project, you should be aware and know the other projects that are in the area. One, because you do not want to duplicate what another project is doing. Two, you want to work hand in hand with these people, because the goal of humanitarians is to improve the quality of life of people. So there is no need for competition or not collaborating. So for example, if you come in with a food security project where you're providing livelihood support, you might find that there's another project in the same area that is addressing malnutrition, and you can help each other to achieve the same goal of ensuring that the community is healthy and ensuring that you eliminate food insecurity and malnutrition. So it is important that you also identify the people who are in the community doing other projects. And then you have the religious leaders, you have the priests, pastors, sheikhs and imams and traditionalists. So you find that because as communities, there are many factors to consider: the social factors, the religious factor, the political factors, the economic factor. So you also have to include the religious leaders, because religion is a big part of a lot of people's lives, and they go to religious leaders for advice, for counsel, for direction. And so they need also to be involved, because they will help you educate the community, and they will also help you get the community to understand that what you're doing is helping them, and therefore they'll be able to trust you more. Then you also have the traditional health practitioners. So we have traditional birth attendants, traditional healers or herbalists. So especially in Africa, you find that we still practice a lot of traditional things. So you have people in the community, and they are really valuable because they are a wealth of knowledge, who are either traditional birth attendants or traditional healers, or they are very knowledgeable about the herbs. And so they are highly respected and held in high regard by the community. So also, even if you might view it differently, and maybe you want to do things the scientific way and all that, you have to respect the place of these people in the community and understand that they are highly respected, they are highly valued, and their opinion really counts. So you also should include them. And then we have community groups and organizations. So these are women groups, relief committees, youth groups, adult literacy schools, school teachers and children. So you find that in communities, a lot goes on. You may find that there are women groups who meet. There are maybe youth groups who help sensitize the community. There are other committees that are already in place in the community. So all these community groups and organizations are also very key representatives. And now we look at the importance of community mobilization to implementation. And so we have a diagram here, or a visual representation of something that's an existing structure, if I may say that, that you should have in mind. So when you're going to the community, you should know that there is likely already an existing structure. So when you want to get from the health facility or from that high level and you want to get to the community, there is kind of a hierarchy. So you have the health facility, and this, or in that level where you get the chief or the district officer, the technical officer in charge, the nutritionist, the community representative, all of those at the high level. And then the representatives under that, you have the community representative, you have the village health committee, you have the community health workers. And then when you go down to the village, you have the village health committee, you have the sub-chiefs, you have the community health workers, the community volunteers, the village elders, the traditional birth attendants, the religious leaders. So you have to look at it in that sense. So when we're talking about key community representatives, it's from the village up. So don't just involve people at the health facility level without getting people from the village level or without getting the community representatives, because then you will have a gap. So household members are in general actively involved in preventive and promotive healthcare. They also often manage the clinical care of the critically and chronically ill. Therefore, it is essential to work with households to give household members a chance to influence how care is delivered and to regain the people's confidence in a given health system. To ensure nutrition care at community level, it's important to focus on enhancing household capacity and to have discussions that enable household members make informed decisions both for health and for nutritional needs. So when you have a food security program, you have to think down to the household level. So in every household, there is a way that they are organized and they make decisions independently. Therefore, if you want to influence their health or to come in with a solution, you have to involve people and get the community involved down to a household level, because the people have to accept it at the household level where they feel that they have a choice, that they are well informed about the choices, and that they can make the best and well-informed decision to be part of the program. Because if at the household level, your program is not understood. So for example, let me give you an example of something I saw. It's not about food security, but it involves health. So there was a time I was part of, I was working in a certain community, and the area is malaria prone. So as you know, in Africa, there are some tropical diseases that are really problematic. And in Kenya, malaria is one of those. So I was working in an area where malaria is really a very big issue, especially to the children and the mothers. So there is an NGO that came in with a project to distribute insecticide-treated mosquito nets to the mothers, which is a great idea because it will prevent the spread and the occurrence of malaria. But what they did not do is involve the community. So they just involved the people at the health facility level, at the district level. They gave mosquito nets, they donated. Their donation was very gladly received because, of course, it's a very good intervention, but the community were not involved. So they did not know who brought these nets and what are they for. So now the nets started being distributed to the community without their involvement. So the community health extension workers were given mosquito nets and they were told, just go and distribute to every home that has a child under 5 years or a pregnant mother. And they did that. But because the community did not know what was going on and they did not understand the value of these mosquito nets, you'd find a lot of homes used those mosquito nets, cut them up, and used them as a sort of fence around their vegetable gardens to keep off the chicken, so that their vegetables are not eaten. And I would wonder to myself, why are these people not using these mosquito nets? It's for their own good. Whoever came up with this project and invested a lot of resources into it was really trying to solve this problem. So one day I asked a certain woman, I asked her, why have you fenced your vegetable garden with a mosquito net instead of putting it in your home? And they told me, well, whoever brought it to me did not ask me if I wanted it. They also did not ask me what I know about it or how to use it. So I found a use for it because the option was, the other alternative was to keep it in my house and not use it. So you can see how some resources can really go to waste if you do not come and sensitize people to the household level, where they can understand what your intervention is about and also how important it is for them. So you have to think of your project as the impact it will have to individuals right down to the household, where they can accept your intervention and it can be able to also help them. The foundation of service delivery is the community level. So the community defines its own priorities, and services are provided based on the priorities, which creates ownership and commitment. So a village health committee is a community structure essential to the process. Households and individuals participate in the village health committee and contribute to their own health and that of the village. Community representatives relay health and nutrition-related issues affecting the community to the Health Facility Management Committee. Information from the health facility is then channeled back to the community. So as you can see, there is sort of a way information goes up and down this chain of the community and the village. So we're saying the village health committee is a structure that gives a forum for households and individuals to participate and to communicate about their health, about their challenges, about what is going on and all that. And then the village health committee and the community representatives then forward those issues to the health facility or to the higher management. Then the higher management then forwards that to the ministry and to the government and so forth. So you have to understand that if the community does not participate in your project, then it will be like you're building a house of cards. It will come down on itself at some point, because at the base of it all is the households and the individuals. And then on top of that is the village health committee and the community representatives. And then you have the administration, the health facilities, the district officers, all of that. So if at the base of it all, the individuals and the households do not accept or understand your program or your interventions and they reject them, then it means that you will have a really hard time implementing any of your programs. There are significant advantages to shifting the emphasis of the network to engaging and empowering community members. Community members who are experiencing hunger are the foremost experts on this issue and have much to contribute in solving this problem. If community members are empowered to get involved with initiatives to fight hunger and increase food access, then community-based organizations and emergency food programs can build their capacity to work on new initiatives and improve current programs. Empowering community members does not only result in capacity building, it also leads to long-lasting change. So when you shift your emphasis from just networking and getting to know the community and all that, and you engage them and you empower these community members, you're going to see that you help these people and you do what we call capacity building, where you give them information, you give them tools, you give them knowledge on how they can help their own situation. And also it will help your project have lasting change, which is what in the humanitarian field we are all after. We want lasting change, we want lasting impact. So if, for example, you have a food security project, then the community members really understand what is the problem and some of the best ways to solve the problem. So you cannot ignore that even the community might have a lot of information about the problems they're experiencing and how to solve these problems. So if, for example, you come in with a food security project and you identify that this community has very high rates of food insecurity, and you decide that we are going to carry out a food for work program, where people come to work and work on projects, and then we give them food to take home to their families. But that is a very good intervention. But on the other hand, if you engage the community members and you ask them how they can solve the hunger and how they can solve their food insecurity, these people might tell you that we would appreciate if somebody dug for us a well, because our issue is not that we do not know how to farm. Our issue is that we do not have enough rainfall that we can depend on. But if we had water, we could farm and we could also grow our own food. So you see, there is one intervention that will come in, help them in the short term, and you might not be able to sustain it for 10, 15, 20 years. But if you find a way to engage the community and understand their problem from their perspective and involve them in coming up with a solution, you will not only help them in the short term, but also in the long term, where your impact will be felt long after even you have gone. So that brings us to this topic of community participation. And now I will open up the floor for your comments, for your any questions, so that we can discuss, because I want it to be a discussion, because this is something that we implement on a day-to-day basis. There are challenges you face. There are also maybe a lot of questions you might have. So I am going to open up the floor for a bit of a discussion, so that we can also learn from each other. We can ask questions and before we proceed.
Thank you for that, Irene. I think I can see a hand up. Mr. Yusuf Kasim. Mr. Yusuf Kasim, are you there with us? You can unmute your microphone. Mohammed Hassan, are you there with us? Mohammed Insha Hassan, you can unmute your microphone. Ladies and gentlemen, if you want to be given a chance to talk, you can raise your hand, and I will be unmuting your microphone so that I can give you an opportunity to talk. And when I do so, kindly unmute your microphone, and then you can begin to talk. I have Drichi Stephen Biko.
Yes, thank you very much, moderator. My name is called Stephen Biko, currently in South Sudan. My questions goes to our presenter, and most of the items that she has brought forward is something that we do experience it in the field. It's a first kind of hand information so we are getting. But I will realize that we are implementing some projects in different contexts. For example, these steps, the 5 steps that we're using, we are taking in a community mobilizations. Does it apply all to emergency context or in other developmental contexts? So that is what I wanted to inquire. Thank you. Over to you.
Okay, thank you for your question.
Over to you, moderator.
Yeah. So thank you for your question. It's a very good question. So there are different circumstances. So you may find yourself in an emergency situation whereas another person is not in an emergency situation. So when there is an emergency situation, you may not have the luxury of time to carry out the 5 steps, but you still need to involve the community to some degree. So you may not have the luxury of spending an entire month just educating the community, because in an emergency, of course, you're dealing with a case of what you want when you want to help the community versus very little time. So you may not be able to carry out everything in the 5 steps, but you still need to identify people in the community to help you get your project off the ground and accepted by the people. So you need community participation. Even in an emergency, you may not carry it out the way we've discussed it or have the time to do so, but you still need to identify key people who will help you get your message to the people and get the people to accept the help you're offering. I don't know if that answers your question. So you will involve the elders, you will involve the leaders, because even in an emergency, the social structure sort of remains the same. The administrative side still remains. The village elders are still village elders. What they have to say is still important. So you may just involve them, but sort of not to the extent as if it was not an emergency.
Richie, I hope we got to answer your question.
Yes.
Yes, sorry about that. You were saying?
Yeah.
Okay, thank you, Stephen. And
thank you very much. That is well articulated.
Okay, thank you, Stephen. Irene, I also want to remind you we have a few questions on the Q&A. Maybe we can also get to answer a few of them.
Okay, let me answer those on the Q&A before we go back to our audience. So Nabdillahi, you asked, hi, we have challenge for community mobilization. Since we are ladies, as you mentioned, because of cultural perspective, the community leaders or community gatekeepers are happy to deal with men rather than women. Do you have any recommendations about this? So yes, because of our cultural norms and setup, this unfortunately sometimes happens. And the best way to change this is to educate the people and also find a person in the community who is on your side as the lady and who will help you get a platform where you educate these village elders or the community leaders on your role that you're playing. So it may take a while, it might not be immediate, but we have to persist. And the only way that these people will take us seriously as ladies in terms of culture is if we continuously educate them on the role we have to play. Also, sometimes legislation helps, where you find that, for example, the gender rule, where even in that village committee that there is a representation of women, that might make it easier for you to get an audience if there are women also involved as leaders or as community gatekeepers. So also maybe that is another way we can look at it, where we try and get more women into leadership and into these positions so that they also give us an audience. The other way is to really learn the culture of these people and try to get your message across as respectfully as possible. Because as the world is changing also, more women are being given an opportunity to go to school, to educate themselves. So it is changing slowly, but surely it is changing, especially in Africa. So just keep at it and do not give up, my fellow ladies. As challenging as it is, we are starting to see change slowly. So try and learn these cultures, be respectful about these cultures so that they can take you seriously. Also, we need to fight for legislations and representation that involves women, because if women are there at the table, it is easier for other women to be given an audience. Okay. And then we have a question from Mohammed Salad Abdi. So with much respect on going the webinar, I would like to inquire you the 3 steps, step 3 of community sensitivity. You mentioned that first priority is to consult the community members according to the cultural issue. So do you mean community leaders? As well, how about if there is an administrative running where then I want to conduct community mobilization? So who most important to go to first and foremost to consult regarding the intervention based on the community needs? Community elders or administrative? So in this situation, yes, I meant the community elders. You talk to the elders before you talk to the community. But in a case where you have community elders and the administration, I would consult the administration first, because they are representatives of the government, and we need to make the government aware of any activity that is there. Actually, some projects, in some instances, you cannot carry them out without approval from either the Ministry of Health, the Ministry of Agriculture, or the ministry involved. Because you see, at the end of the day, the work of the government is to protect their people. And that involves being made aware of all the activities that are going on as much as possible. So first, get approval from the administrative side. Make sure that all the administrators who need to be made aware, whether it is at the ministry level, at the district level, that the administrators know. Then after the administrators know and give your project a go ahead, then you can go to the community. Because unfortunately, there are some activities that might bring a problem with some local governments. So even if you get approval from the community elders or from the community, but the administration shuts you down, then really that will be unfortunate and will take you a few steps back. So get approval first from the administration and then proceed to the community. And then RedMe Notes asks, for example, I'm going to implement the stocking activities to improve the livelihood of a certain population. How am I going to implement this program? Thanks. So the first thing you should do is to come up with a program design. So before you even come to community mobilization, you have to plan a program. And when you're planning the program now, that document, that project is going to involve your plans of action. So first of all, you have to identify a problem, which you have already identified, I guess, from your question, where you want to improve the livelihood of this community. It might be pastoralists, from what I can gather from the question. So after you identify the problem, then you have to now come into the planning phase. And the planning phase involves identifying how you're going to reach your target audience, identifying who they are even in the first place, identifying all the key players or all the key stakeholders that you need to involve at that point, identifying how you're going to get these people to agree, first of all, to this talk. Because you might come across a cultural issue where if they are pastoralists, from what I understand, most pastoralist communities attach a very high value to their livestock. So you might need to do a lot of education and actually a lot of community mobilization to convince these people to actually destock. So after you identify how you're going to carry out your program and how you're going to educate you come up with a message to educate these people, then now you come to community mobilization, even before you carry out your program, where you identify the key stakeholders, you carry out an assessment, and see at which level are you going to involve the community, where the community is in terms of this problem. Do they even see it as a problem, or do they want other solutions? Is the solution destocking, or do they want a different solution? Then after you do the assessment, then you identify the leaders, the key stakeholders that we talked about, talk to them about your program, help them understand what it is you want to do and the value you want to add to the community, and then now go down to the community and educate them, sensitize. So you tell them about the project, tell them how it's going to be beneficial, and get them on board. And then after you get the community on board, then you can start implementing your project. I hope that was helpful. And then Often Book asked, hello, some of us have a personal platform, NGO we are developing. Please, is it possible for HG link us up with organization working in the communities? So I will let Eric answer that one. Eric?
Yes, Irene, I think I will get back to him in conjunction with Anthony. So we are going to get back to him.
Okay. Yes, so somebody will reach out to you and give you all the information you need. Then Rahila asks, great presentation, thank you. Are there any challenges we should anticipate in community mobilization? Yes, there are very many challenges that you can anticipate when you want to carry out community mobilization, depending on the situation. So as the first question that I answered suggested already, that is challenge number one, where you find out because of our cultures and our traditions, there are certain limitations or challenges you might face. So for example, if you're a lady, they might prefer to deal with a man, or they might not even give you audience or might dismiss you. So there are cultural challenges. You might also find that there are cultural challenges in terms of what is culturally acceptable. So you may have identified a problem within the community, but because of the cultures and the traditions of these people, they do not want any interventions, because to them, they value it as part of their culture. So for example, you find a lot of NGOs struggling with dealing with FGM, or the female genital mutilation. And the reason they struggle with it is, from the scientific and medical perspective, it is not right. But in some cultures and some traditions, it is their tradition, and they do not want to let it go because they value it. It holds a certain importance to them. So you can also come across some cultural practices, some beliefs that challenge the very thing you want to address. So to you, it might be a problem, but to the culture and tradition of these people, it is important to them, so they are not willing to let anyone interfere with it. Also, you will find other challenges, maybe like even getting to the community themselves. So infrastructure in itself might prove to be a big challenge, because when you're doing community mobilization or community sensitization, you need to get to the community levels. You need to go to where they are. So infrastructure in terms of maybe the road networks might be challenging, transportation getting there might be challenging, even organizing for a meeting where you're allowed to gather people on a day and you're given audience might prove to be a challenge. And therefore, now that is where you make use of all the channels of communication, because if you cannot get to the people, then you find a way to get the message to them. Another challenge you might find is language barrier. And in this, it might be challenging because as a humanitarian, you work with a diverse group of people. So you might find yourself in a community where you do not even understand their language, and they find it difficult to understand your language, even if it is the national language. So, and then therein comes the problem of the education status of these people. So you may find that you have challenges communicating to these people and getting them to understand, either because of a language barrier or because of the levels of literacy in the area. Another challenge is that you might find that the administration or the political side of the community are challenging your project. So because of the nature of politics, you may find that there are some political issues with your project, and they may try to interfere. But as humanitarians, we do not take political sides. We want to help the people, but that might come up as an issue. You also have the issue of finances, obviously, because to carry out community mobilization will take a lot of resources, monetary, in terms of human resources, in terms of transport and all that. So if, for example, you want to run a media campaign about a certain issue and a certain project ongoing, of course you will need money because you need to pay for it. So you might also have monetary challenges, and you might have to get creative on how to overcome those. So yes, there are some very many challenges that you may find yourself encountering when you're trying to carry out community mobilization. And then what is the difference between community consultation and community sensitization? That is from an anonymous person. So community consultation is where you want to get feedback and you want to get to understand the challenges that these people have, and you want to understand what is important to them, what is a challenge to them. Community sensitization is from you. You want to educate the people about a problem you have identified and how to identify the problem, how to solve the problem, how to prevent the problem. So the flow of information is different. In community consultation, you are gaining information from the community. In community sensitization, you are giving the community information. Then Jabril Mohammed asked, the last 2 decades, we're facing drought that caused famine, food security in East Africa, and the community need a solution for sustainable food security. So how can we manage it? Thank you for that question, but it's a very wide question. So when you study food security and nutrition, which is a course that we offer at Humanitarian Global, we are going to cover all the different angles and perspectives of this and how we can ensure that we come up with sustainable food security. But in the context of this forum, I'm just going to mention a few, but I'm going to encourage you to follow up with us and register for a course so that we can guide you on how you can really deal with food insecurity and even how you can come up with a food security program. But you can come up with capacity building projects. For example, you can come up with ways that you can empower the community to farm. You can teach them sustainable farming methods. Because of the farming, you can introduce farming resilient crops that they can grow. You can also show them alternative methods of farming that do not rely on rainfall. For example, the different forms of irrigation, even the ways that we can plant using drip irrigation, for example. You can also come up with legislation that subsidizes some of these farm inputs so that the farmer is able to afford to cope. There are very many different ways that we can deal with food insecurity in East Africa. So that's a whole entire different topic, but those are some of the ways that we can resolve this. Then Michael asked how to ensure community organization before mobilization, as well as their contribution and ownership of food security program. So for you to be able to understand how the community is organized, you have to carry out an assessment, which was our first step, because different communities are organized differently. You may go to a community and find that they do not have the village health committee, they do not have health extension workers, they only have social workers, and then there is the chief, the religious leaders, and then the people from the district. But you may go to another community and find that they are really organized, that they even have village elders that represent households, then they have the village health committee, then they have the community representatives and all that. So the easiest way to establish how the community is organized is to carry out an assessment and get to understand their level and way of organization. Okay, and when you're carrying out this assessment, you will also understand the role that they are going to play. So for example, if you go to take two communities, where one community is really well organized with household representatives, there's a council of elders, there's a village health committee, there are community representatives that represent all the other stakeholders, there's a very good administrative framework up to even the district, the national level. There's a framework and a way of organization that you can really follow. And then you go to another community where you only have the administrative side, you only have the chief or the sub-chief, and there are no, and then maybe the village elders. There is no village health committee, there are no women groups, no youth groups that are really organized or anything. So you see, in our first case, when you're involving them, you will really have to break it down to what does the village health committee contribute to my program, versus in the other hand, there is no village health committee. So I have really to make use of the village elders and the chief to help me disseminate my message. So I don't see if you can understand, I hope you can see the difference. So it's community to community, they differ. But the first step, always carry out an assessment to understand how the community is organized. When you understand how they are organized, then all the pieces will fall into place. You will know who represents what and their role when you want to disseminate your message. And then somebody asks, is community mobilization done at the planning or the implementation level? So different levels of community mobilization is done at both. When you're carrying out planning, you need to plan for community mobilization. And that is where you will identify how the community is organized, how you're going to carry out community mobilization. So at the planning level, when you're planning all the activities of your project, you also need to plan and spell out how you're going to carry out community mobilization. So at that point, you're not actively engaging the community, but you're planning for it. And when you're planning for it, it means you have identified these key stakeholders. You have identified how the community is organized. You have identified the ways that you're going to make sure that you have contact with these people throughout the length of your program. And then now at the implementation level is when you're going to carry out what you planned. So when you're coming to the implementation, because you had already identified these people, you had already come up with a plan of how you're going to do it, then it becomes very easy. So community mobilization is included in your plan, should be part of your project plan, and should also be part of the implementation. But the planning does not really involve engaging the community. But when you start implementing, then you start engaging them, setting up the meetings, talking to them, and all those activities. John Bosco asks, I wanted to add that community mobilization and sensitizations can be ongoing. First meetings are for raising awareness and get a buy-in from the community and its leadership. That is very true, Mr. John. And you also continue and say, consequent periodic meetings help in community participatory monitoring of the program implementation. And this enhances ownership, sustainability of the intervention, and checking real-time progress, whether on track or not. That is very true. And that is why step 5 of our process was ongoing mobilization. So that is what really you are adding on to, John. Thank you for that contribution. So yes, the first meetings when we have the community awareness in step 2 is really for raising awareness that you have identified this issue, that this is how we are going to deal with it. These are my suggestions. And then getting the community to agree with you. That is what he means when he says a buy-in from the community and the leaders. And then the other meetings, as we said, including the follow-up and all that, will help you see if your interventions have been effective, if you're on track, you get feedback from the people and all that. So thank you so much for that contribution, John. I think that is all for now for the question and answers section.
Thank you, Erin, for that. I think we can continue. Had you any more slides left, or do we go back to the Q&A still?
We can go back to the Q&A if anybody is raising their hand before I finish up. If anybody has a question,
you can see a few hands up. I think I can see John Bosco. John Bosco, are you there, boss?
Yeah, okay, thank you very much. This is John Bosco from Malawi. I hope you can hear me.
Yes, I can hear you. Continue.
All right, thank you very much. Actually, it's the comments that I have put in the chat box, I mean, in the Q&A, but I wanted to emphasize that there was a question as to where can community, or where is the community mobilization most applicable? For me, practically, I would say that in all projects, whether humanitarian or developmental, community mobilization and sensitization is very key, because that's what defines the impact or the results of the project. If we miss the community mobilization, it doesn't end well, because a lot happens at community mobilization and sensitization. One, we need to identify the stakeholders and the gatekeepers. We have some people who will deliberately confuse the community not to accept the project. So we need to identify them at this very early stage. Secondly, we need to screen the beneficiaries, rapid assessment. We need to identify our beneficiaries and get them registered at this very level. Because if we miss this, we may end up working with people that are not the project target. And so at the end of the day, we find that we are putting resources to wrong people. It becomes off target. So community mobilization really is very key. I have been working with the World Vision and Humanitarian Emergency Affairs funded by the World Food Program. Those are the processes that we do either for food for asset, cash transfers, talk of these other programs, do it more humanitarian, and I'm a humanitarian accountability partnership officer. So you see that this enhances accountability even of the project, transparency. All the community members, whether beneficiaries or non-beneficiaries, should know the project. They should prioritize those that are really in need, that they should be in the project. So I really wanted to emphasize on the importance of community mobilization and sensitization. It's very crucial because that's what defines the project. Most of the projects have had problems at the end simply because it was off target and was being realized maybe in the after mid-term evaluation. Thank you very much for giving me this opportunity.
Thank you for that, John Bosco. And Irene, do you have any comments to add on that?
No, I appreciate that comment because it's very true what he is saying, that community participation is not just for nutrition or food security programs, it's for all programs. All programs that involve the community should really involve the community. And if you do not do adequate community mobilization and participation, then as he said, you will find a lot of challenges, even as you try to do an evaluation and establish what your project did. So yes, thank you for that, Mr. John Bosco. We appreciate that.
Yeah, thank you for that. I think I can see another hand up. Madi Bile. Madi Bile, are you there with us?
Can you hear me now?
Yes, I can hear you now, Madi.
Yeah, thank you very much for giving us this great opportunity and the impressive presentation regarding the topic. Just regarding the implementation of the projects or program is when it comes to the community mobilization, actually it is very important to have continuous community mobilization in order to improve the project implementation. Also, before the project is being implemented, I think it's very important to have community involvement, like whenever we gather in assessment information, we have to have ensure that the community should be involved, and the requirement of project scope should be given their contribution based on their preference, on their priority, or based on their needs. So that in Africa or any other countries, it seems that there is a lot of beneficiaries taking some aid from the humanitarian agents. So I think any project should be given and should be impactful to give the community, target community, to have sustainable impact. Like the beneficiary should not remain a beneficiary for a long time, but we have to have a sustainable, impactful project in order to ensure that they move to another stage which is not beneficial. So thank you very much for giving me this opportunity. Over to you. Yeah, that's over from me.
Okay, thank you so much for your comments. That is some very good points that you have made, that we have a challenge of attaining sustainability in projects in Africa, where people just want to remain beneficiaries of projects, but we need to think about sustainability as well. And involving the community is actually a very good way of attaining sustainability, because when we involve the community and especially get to understand the source of the problem, the root cause of the problem, and also how the community can be empowered to be part of the solution of the problem, then that really will increase the sustainability of our projects. So thank you so much for that comment. I can see another question on our Q&A from Mohammed. So for public health perspective, reflect with community health mobilization and sensitivity have much impact economic aspects. What is the appropriate steps to approach the periodic health challenges? So as we had a comment from one of us in the audience, and I seconded that, is that community participation is not just for food security, but also for all kinds of projects across the board. So from a public health perspective, is that you need to look into involving the community, because public health deals with the health of the community at mostly the community and household level. So you need to approach these periodic challenges and ask yourself if there are periodic outbreaks of some diseases, maybe diseases that are infectious or communicable diseases, as we call them. Then maybe we need to involve the community and really get them to understand what the problem is, how we identify this problem and how we can solve it. So for example, if you find that there are periodic outbreaks of things that are have to do with maybe hand hygiene or water and sanitation or wash, then you can actively engage the community and then carry out community mobilization and sensitization, where you teach these people about the importance of good water and hand sanitization and hygiene. And you come in and then identify the source of the problem. Is it because our water sources are being contaminated? Is it because the people do not have proper toileting? Is it because these people do not understand the importance or even the technique of good hand sanitization or hand hygiene? And then when you involve the community and you engage them from a public health perspective, you get to understand the key source of the problem. And then you can also help them solve it. Because if you do not involve the community and these problems keep coming up now and again, it means from the community level, there is a gap. And the only way you can identify the gap that you're having is by involving this community. So from a public health perspective, community mobilization will really help. I have another question from Michael. So community mobilization and participation should also include community contribution and ownership to ensure sustainability of the food and nutrition security program. May you shed more light on the importance of community mobilization in sustainability of any community program? So your question might have already been answered, but I'm going to reiterate again. So we say that when we involve the community, then we can get sustainable projects, because one, you can be in a position to understand the root cause of the problem. And therefore your initiatives or your activities will be more centered or geared towards addressing this basic problem so that it can solve the issue once and for all. The second way is that when you involve the community and there is participation, then you can do what we call capacity building, where you help these people understand what the problem is, how it's affecting them, how to identify this problem, and also ways in which they can be able to solve this problem. And then you can come in, and when they have been involved in identifying these ways that can solve this problem, if it is education that these people need, then you educate them. If they need a certain set of skills or tools, then you can provide that for them. And then that means that even after your project is done and you leave, then you still leave these people with the information, with the skills. And that is what we mainly say, we build capacity in the community to help them help themselves. The third thing is, when you get community participation, then you get direct feedback from the community. And in this way, you can adjust your activities in a way that they are more effective and therefore more sustainable. So when you engage with them, they will tell you that this intervention is not working, or you have not reached the people who could benefit the most, or this way of delivering the message is better understood than that one. And therefore your activities in themselves become more effective. Michael Tack asked, what is main strategy mean in community mobilization for a community member who already have misinformation about the service that the NGO is providing? So if there is already misinformation about what you're doing, the first step is to demystify what you're doing. And the only way you can do that is by providing the correct information. So you have to do a lot of community sensitization and a lot of community education. So if people do not understand what you're doing and are therefore giving false information about what your project is doing, then the only way to counter that is to come in with the correct information and educate them about whatever it is you're doing. So your main strategy here is you have to take a few steps back, because if there is misinformation, then probably you will have challenges with acceptance and people might disengage and stop participating in your project. So the only way and the best way, in my opinion, to counter that is to come in with the correct information and start sensitizing and educating the community about what you do before you can even proceed. Those are all the questions I can see in our Q&A.
Thank you for answering them. I can still see a few hands up. I have an Abdirizak Sharif. Abdirizak, are you there with us?
Yes, I'm with you. Can you hear me?
Yes, I can hear you.
Yeah, this is Abdirizak Sharif Mohammed from Somalia.
Yes, you may proceed.
I want to hear the difference between participants and beneficiaries. This term is normally used interchangeably. So which one is appropriate mostly to the community? Thank you. That's all.
Sorry, I did not get your question clearly. Please, could you kindly repeat that?
Okay, I said there's a term is beneficiary and participant, which normally are used by different organizations for the community. So which is mostly appropriate and how it is used? Thank you.
Okay, so you're saying that in a project there is the participant and then there is the beneficiary.
Exactly, you have understood.
Okay, so when you're carrying out community mobilization, at the back of your mind, you know that your participants or the people that you're targeting are part of the community. Yes?
Okay.
So if you want to have an effective project, you need to educate the entire community and not just the participants. Okay?
Okay.
So if because these participants are part of our community, right?
Okay.
They are part of households, they are part of a village, they are part of society. So you cannot go and single them out and tell them, I have identified you because you fall under this criteria and therefore you need this help. That will bring a lot of, it might even bring a lot of stigmatization, and people might reject your project because they will be wondering why nobody else knows about this, why did you single me out and all that. So it's important for the entire community to know what is going on, even if not all of them will participate in your project. Okay.
Okay, thank you. Thank you.
You're welcome.
Thank you for that, Irene. I can also see another hand up. I have an Ibrahim. Ibrahim, A20S. Are you there with us? Ibrahim? Maybe as we wait for Ibrahim, we can talk to Hassan Ali Abdi. Hassan, are you there with us?
Yes, I'm there.
Okay, Ibrahim, we can start with
Can you
you.
hear me?
Yes, I can hear you.
Yes, I'm hear you.
Okay, we
Hello.
can start with Ibrahim's question, then we can go to Hassan's. Okay, Ibrahim, you may ask your question.
No, enough. Enough
Okay.
to ask that others.
Okay. Hassan, are you there with us?
Yes, I am here with you. Can you hear me?
Yes, I can hear you, Hassan.
Yeah, mine is only one question. We probably I'm from Somalia, currently in South Central. The problem we have in terms of community mobilization or community mobilization or community participations, we work in some places in security problems. So where we are facing a lot of when your information is being exposed to the community, some community may be at least submitted to at least gangsters or something of that sort. So it is sometimes negatively affecting our day-to-day activity. So under these five steps of community community sensitization, I sometimes skip off because of my own reason of safety and the program implementations. Is there any other ways that you can advise these community mobilizations? Hello.
Okay, thank you. Yes, thank you for your question. So as we all know, there are different contexts to where we work. So there are people who are in contexts like yours where there is insecurity. There are people who are in an emergency situation. There are people who are dealing with famine and hunger. There are people who are dealing with development. So there are different contexts. What I would say to you is you should try and identify ways where you can engage the community in a safe way, because you also should not endanger yourself or your staff in any way because of the conflict that is going on. So if there are ways that you can engage the community, even if you are only able to carry out a meeting with the elders without in a safe way, without endangering yourself or your staff, sometimes we work with what we have. So the 5 steps are only a guide. You do not have to stick to them no matter what. You do what fits your context. But the idea is that the community has a clue or know about your activities so that they can accept your help. Because if they do not know why you're doing what you're doing, then they will not want to participate. So the 5 steps are only a guide. You have to now at the ground level come up with ways of how to safely and taking into consideration the environment you're in, how you can involve the community and also to what extent. Because sometimes, as you have pointed out, it is not possible. So yeah, it depends on context to context basis, but you just try and educate the community about the problem that is there and how you're helping.
Hassan,
okay,
are you there with us? Hassan? Okay, I think I can see another hand up. We have a Redmi Note 10s. Redmi, kindly unmute your microphone. Redmi, are you there with us? Okay, as we wait for him, we have Jibril Said Duale. Jibril, are you there with us? Jibril, kindly unmute your microphone. Jibril? Okay, I think can see one more hand up. Chol Moses Majok, are you there with us? Chol Moses Majok, kindly unmute your microphone. Chol, are you there with us?
Are you getting me?
Yes, I can hear you now.
Thank you.
Yeah, thank you. You may proceed to ask your question.
Thank you, sir. I've been following the presentations made, and it is actually really interesting. I'm participating from South Sudan, And in 2017, I worked as a community mobilizer on the nutrition program. One of the challenges I faced during the work was in my country, there is a tribal war, and the community I was working with are in problem with my community. It was really a challenge for me to communicate to them in the dialogue that they would really understand, and I was being mocked because my people are in trouble, I in conflict with them. I couldn't have participated very well. If such things happen in the community mobilizations, what could be the solution to the staff and the community I'm based to work with? Thank you.
Okay, thank you for your comment and your participation. So as I said before earlier, that some of these situations that we work in can be really challenging, especially in areas of conflict. So in areas of conflict, especially when it's a local conflict and there are two different communities fighting each other and you come from the other community, it can be quite a challenge. So I understand that, and that comes as part of the job as humanitarians. What I can encourage you is that as humanitarians, we operate under a code of ethics that states that we are non-partisan. So when a conflict is going on, we do not participate in the conflict. We really just want to help and preserve human dignity. So in that situation, maybe you could involve the local administration to provide some security, or you could also identify members of that community that you want to help who are like-minded and who understand the role that you are playing as a humanitarian without it being about the conflict, and use them as points of contact in the community, because you need a few people on your side in that instance. So you can either get security or try and identify people from even that opposing community, because even in a conflict, there are people who can really come in and see that you're trying to help them, so they side with you and they help you help their own community. So those are some of the ways that you can do that. But I applaud you for standing your ground as a humanitarian and helping even in a situation where the conflict directly affects you. That is really the heart of humanitarianism. So I think we are done with the inquiries and with the questions. And I'm going to hand over back to Mr. Eric. Thank you so much for participating. Thank you for making these a very lively discussion. We have learned from each other. We have encouraged each other. Even we have made contacts and found out new ways to encourage ourselves and to continue and keep on keeping on with the humanitarian work that we carry out. So thank you for your participation, and I hope even in future you will subscribe and participate in also more webinars that we are going to organize. So I wish you a good weekend, and I hand over back to Eric.
Okay, thank you to all of our participants. I think my colleague Eric is experiencing some challenges. And once again, it has been a lively session. My name is Anthony Mukuhi, and thank you for joining our session today. So as you wind up, I would like just to share my screen to take you through some few announcements when it comes to some of the questions that we can see on the chat section. How do you access the recorded version of the session after you've been able to complete the session? So what we normally do, once a day after the session, we're going to upload the recorded version on the YouTube channel. So how to access the YouTube channel? First of all, we do send you an email, and it does have the link for you to access the slides and also the YouTube channel. So also once you go to the website, there's a link for YouTube. So if you can click on this link, it's going to redirect you to the YouTube channel. And that's where you can also find all the webinars that you've been able to host for the very many times that we've been able to organize for these kind of sessions. So apart from food security, we also have very many other webinars, and we encourage you, go to our YouTube channel, ensure that you can subscribe so that whenever we post a new video, you also get a notification. So like for today's session, we're going to get it from tomorrow. So you're going to have it being uploaded there. Also, when it comes to the slides, for instance, if I go back to the first session that we had in food security, that means once you go to the description, there is a link on how you can also reach out to us. So that means we provide you with all the information so that in case of further interest in studying with us, you have the links and also the details on how you can reach out to us. In addition to that, we've highly recommended you and encouraged you to enroll for further training. So we have very many courses, and these include the food security, nutrition in emergencies, what you are covering today. So once you go to the website and you want to enroll for these programs, you can see them enlisted there. And for example, if you want to enroll for a diploma in food security, that means you can click on that link, and this is where you find all the information. So you can find information in regard to the course outline, you can see what would be covered, and all these details have been provided there for you to go through them. So for further engagement, you can click on apply now, and that link would take you to a simple form. And this simple form is the one that is going to take you through on how to register. So just a few details for you to leave us with so that we can reach out to you and guide you further when it comes to the enrollment. And also something else that I would like to insist and also encourage you, go through the YouTube channel as recommended so that you can review the many sessions that we have had there. You can share the links with your colleagues, and I believe as much as we might be in this field, we also have colleagues and friends who are in the wash field, in the meal sector, or maybe field area of study in the disaster risk reduction and management. So we have all these kind of webinars, and they can always get to access them there. So thank you so much for attending our session today. We're going to share the slides with you tomorrow, and also the recorded version from Humanitarian Global. We wish you a great weekend. Let's continue communicating. And for now, I'll leave you with some of the course outline videos so that you can know what would be covered in each and every level. So thank you so much, and may you have a great weekend.
According to Food and Agriculture Organization of the United Nations, projections show that the world is not on track to achieve zero hunger by 2030. Additionally, majority of the indicators are also not on track to meet the global nutrition targets, with a further deterioration being projected due to socio-impacts of the COVID-19 pandemic. A solution is required to help humanitarians get knowledge and understanding of the main concepts of food nutrition and malnutrition, food security, and how they impact livelihoods to steer the world achieve zero hunger. Undertaking a diploma in food security and nutrition in emergencies prepared by Humanitarian Global ensures you get in-depth knowledge and understanding in assessment and targeting in emergencies. In the first module, participants get to learn more about targeting in emergencies, food availability, methods of nutrition assessments, and nutrition surveillance. Malnutrition in emergencies. The second module tackles malnutrition in emergencies, community-based therapeutic care, and both outpatient and inpatient management of malnutrition in emergencies. Planning nutrition interventions. Get to learn and understand more about planning a nutrition intervention, nutrition education and communication, and emergency nutrition interventions. Community mobilization in an emergency. In the last module, participants learn about community mobilization during emergencies, monitoring and evaluation in nutrition emergencies, challenges and actions to improve food security in the community. Apply for this course today by visiting our website www.humanitarianglobal.com for more details.